This is LuisPedron again with our Filipino friend Daus, who just got honored today by the Center for Asian American Health for the National Leadership Award this 2006. I just want to ask you how our gentleman friend, who's also Filipino, who's very young and who's in this field, how exciting is it that we're actually talking about, you know, health disparities, which is not even talked about before or not even recorded, especially here in our area, because you're from the East Coast as well. Would you like to talk about how exciting it is that now everybody's talking about it, and you are a vital part of it as well?
Well, as someone mentioned earlier, yes, there's a lot of people now talking about it, and it's going to take sort of us keeping that conversation going on to get some action. So I agree, it's nice that a lot of people are talking about it, but I'm also thinking about, well, what are we also going to do about it? And you know, hopefully, I mean, that sort of goes along with the theme of the conference: is take notice, take action. Let's figure out what we're going to do.
Do you have any suggestions to layman people who are not in the medical field, what they should do in at least informing people that there are services out there that we should avail?
Well, I think, number one is that, you know, this is, I think the attitude we have to have is that this is our country, that this country has benefits that go to all Americans, and we are those Americans. And so if it's about healthcare, then advocate for yourself, for your family, ask for what you need, don't be afraid to do that. And you know, look around you and see what other communities are experiencing, both in terms of other diseases, but also what are they doing about it, because we can all learn from each other.
So congratulations.
Thanks.
Once again, speaking to our Filipino compatriots, Mr. Jeffrey Caballero and Butch de Castro. And Jeffrey is actually a panelist who's going to be talking about the topic that's the theme for this conference, which is taking action. Would you like to kind of give us a gist of what you're going to be talking about tomorrow?
We're going to be making some references to how community organizations, particularly through community-based organizations, become more active in the political process, and what needs to happen next for people to be more engaged in politics.
Mm-hmm. And I would also ask Mr. Butch de Castro here about that same topic, because you were originally from the East Coast in the DC area, and now you're in the Seattle area where Filipinos, or at least Asians in that area, are more organized. Us here in New York, organization is still, you know, starting. We're building on people's work, and we're so excited about it. What's the difference between people's involvement in the community in DC and over there?
Mm-hmm. Well, in DC, definitely there are, you know, smaller numbers of Filipinos there. So maybe there isn't much attention, not much interest there, although there are smaller communities in Virginia as well, and in Maryland, but not as organized. In the Seattle area, it's been quite a dramatic change for me to see the landscape of the Filipino community, and not only in population, but in terms of scope and scale of the actions that they take, organizing groups together. And again, what's striking is seeing how they work with other communities of color, not only Asian Pacific Islander, but the Latinos, the African Americans. There's quite an effort to work together there in Seattle.
Since we only have a few minutes on this tape, we just want to ask you about the topic that we were talking about this afternoon. In layman's term, if you were to speak to our audience, what would you tell them in how to avail of services that are out there, and how do you suggest our community leaders, I guess, to help out our compatriots in how to avail of these information? maybe either one of you can talk about that, because apparently there are services out there, but people are not really informed.
Mm-hmm. Well, I would just say having the fortunate opportunity today to moderate a panel of people from both political positions as well as researchers, it's clear that there's a lot of activity out there, a lot of services being offered. One of the huge barriers is that people don't know these services exist. So that's one of the big things we have to continue to work on, is to make sure that we get the word out that there are multitudes of services out there and they are available, and we have to make it comfortable for our community members to come forward and utilize these services, because they are oftentimes free and they are culturally appropriate, and this is the only way we can make progress in terms of bettering the health of the Filipino community.
Any suggestions or views?
Ditto. I can't say any better. But you have here in New York City, you have very fortunate to have the NYU program of Asian American Studies. Any topic, contact the program and find out who it is that they could talk to. The program is very well connected, not only locally but nationally, and there are organizations out there that are designed to help our communities receive the care that they're supposed to.